Hello and welcome to this section. It's around equality and diversity for the care certificate and it's standard 4. So let's have a look around what equality and diversity means. It means we have a duty of care to promote equality. We need to respect diversity and it's essential to everyday part of our lives. We need to provide care that meets the needs of everyone and understand what that means to them and work in a team together. We have what's known around equality and diversity as 2 different things. So equality is about treating people according to their needs, and that's a really important statement. Diversity just simply means describing the differences of people. So we don't need to get caught up in massive political terms around what equality and diversity means. What we do have is protected characteristics, meaning in law it would be illegal to discriminate. And what I mean by discriminate, I mean treat people differently because of this. Now, what's important is to recognise here that you are working with vulnerable people. You have chosen a profession in where you are able to put your beliefs and values to one side whilst providing care for others. Care should be given in a non-judgmental way. So if you find it difficult to separate your thoughts and feelings from providing care, it's important you discuss these with your HR manager. But let's look at some of the things in which we need to consider. Age, appearance, ability, disability, job roles and health. We have people's backgrounds, of social backgrounds, gender, family, friends, sexual orientation and religion. We then have our beliefs, our own values, our own cultures, our races, our origins, and then our marital statuses. So there's a fair amount there in which we need to be mindful for. Inclusion is about the fact that when we work together as a whole and we just bring everyone in. So if I were to run a party, for it to be inclusive, I need to make sure that everyone has access to that party and everyone can arrive. If, however, people can't come here, maybe because of a disability, then I've accidentally and indirectly stopped them, so I've excluded them from the inclusion group and therefore committed a crime. So it's important that we understand how inclusion works. Discrimination isn't just about me going out my way deliberately being nasty to people. It can happen in lots of ways. I may label people, I may stereotype people, and I may be prejudiced. Labelling looks at me categorising you and trying to force you into a box. Stereotyping is all about the fact that I think you are that person based upon a particular thing that you may be doing or saying. And prejudice is the fact that it means not to like someone just because they're in a group or belong to somebody. So it's important we understand those 3 key principles. Equal opportunity provides us an opportunity to take into account people's different needs. It provides fair and equal access and gives a chance the same for all individuals. So that's the fundamental principles around equality and diversity. So how can we reduce the likelihood of discrimination, especially when we work in areas where it is such a diverse community? Well, again, we need to work in an open, honest and transparent way. We need to have open discussions and we need to celebrate all types of diversity out there to raise awareness. We can do that by having equality champions in the place of work who are able to discuss things and to help raise awareness. If we do hear discrimination taking place, we need to be comfortable enough to challenge that. So, for example, sexist jokes, racist jokes, all of those things are inappropriate in a place of work. And actually, if you take part in them, if you hear them and listen to them, or your person that's passed them on, imagine how a vulnerable person may feel, because they may feel that you're going to do the same to them and judge them. So it's important we don't take part in those. Equally, we need to work in a personal-centred way. Working in a personal-centred way is a basic care principle. It means we put the patient at the centre and we work around them. So we look at their needs, their wishes, their wants, not to treat people as a herd. So again, we can see here, personal-centred care, they're the main aspects that they understand in order to meet their individual needs and the person is an expert in their own care. So that's what we mean by when we talk about person-centeredness. I use the word holistic in my other training videos, and again here, when we talk about holistic, we mean the overall health and well-being of somebody, so from their mental health and their physical health combined. One of our 6 C's, so I think we're now on our 5th 6 C, if we're doing this in a numerical order, is now courage. It does take courage to stand up to people. It takes courage to tackle discrimination, and it takes courage to confront situations in which we're uncomfortable with. However, as a care worker, it is one of our fundamental 6 principles. So it's important that we do have the courage to challenge and confront situations that we know are not right and can be harmful to others. So, let's look at ways of valuing diversity. Diversity brings richness, it brings different ways of working, it brings different ways of thinking and lots of collaboration. If we work in a diverse way, we can get the best out of our society, which ultimately has better outcomes for the people that we're caring for. So we shouldn't be afraid to really celebrate diversity and open up the dialogue and start looking at different ways of working. Under the Equality Act 2010, we talk about protected characteristics, and we've already spoken about those further up. But here we have the protected characteristics in law. So age, disability, gender reassignment, marriage, pregnancy, race, sexual orientation, belief, sex and orientation. And again, you can go online and find the legislation and download it. Your care service must have its own policies and procedures around equality and diversity, and it's important you recognise them and read them. We have other legislation that also runs inside with this, and let's not forget now, with Brexit well and truly over with, our policies, procedures and legislation may change due to the way in which our country will operate. It's important that you keep yourself up to date with those changing policies. Some of the ones that we have here are around the Human Rights Act. We know that this is going to be reviewed shortly. Our Mental Capacity Act is due to be reviewed this year in 2020, so that one's changing. We have our Care Act of 2014, which places the person at the centre of their care and is a heart of legislation all brought together. The Care Act also introduced the Health and Social Care Act of 2012 and superseded it. So we know there's lots of legislation there to help us move forward. You can go on to other websites such as CQC to find further information around working with people and ensuring that we're being diverse and we're not breaking any legislation. We know that there's basic principles about wellbeing, and again you can read those in the Care Act 2014, and there's some more links in here. Revert back to the codes of practices that you would have already looked in Standard 1 and Standard 2. Again, you will see in those codes of practices a standard around equality and diversity. A whole page, will be there, and how you apply those to your everyday role. It's important we're able to think and reflect. So looking at Unit 2, looking at our duty of care, looking at how we're teaching and learning, it's important we're able to reflect upon discrimination. We have to challenge our own values around discrimination, because we may be directly or indirectly discriminating people without even knowing. So it's important we have an ability to reflect. You should know where to go for further information, advice and guidance around equality and diversity. And this may be things such as going to extended faith groups or looking at other different services, and again, extended reading. So when we say reflect, we're talking about us to think over our experiences, think about what we've gone through, think about how we would feel, and try and use those to provide better care and better outcomes for people. So let's look at some of the knowledge requirements we need to now complete this workbook. So question 1 looks at key terminology and words, and again it wants us to explain something. You will need to provide a clear account of your understanding. So it wants us to describe about diversity, equality, inclusion and discrimination. Here it's asking you to think about whether things are deliberate or whether or not they're accidental. So it's giving you a statement there, and you need to decide whether it is or is not deliberate. So again, you just read those and answer those. In this question, it's about working in a person-centred way to reduce, and it's asking you to explain something. And here it wants you to explain how the practices support equality and diversity when working in a person-centred way. So that will hopefully be things such as you meeting their needs and their practices. We have another spider graph here. It's asking you to identify, which means you can bullet point things. And it's asking you to look at legislation, codes of practice for equality and diversity discrimination, and list what they are as you go round. Here, we're looking for a describe, which means you need to create a picture of what's going on, and you need to address how you could address the discriminatory practice in order to encourage positive change. So it's giving you a situation where it's not pleasant, and what could you do to promote that and make it better? And again, just follow through the questions and answer those as you go through. Another diagram, so again, identifying things, and this is about where you can get your sources of information to support people where you have a lack of understanding about meeting their needs. So again, what can we do to help meet their needs there? Moving on, finally, we've got another table here, and it's just asking you to complete these with one example for you, and for the second example, think about what you could have done. So here, you realise something, where's your support, how could you access the support, and why, and what you're going to do with that. So again, just follow that through. And it's asking you to complete those two workbooks. Now, equality and diversity is an important subject. It underpins everything we do in health and social care. So please do take your time to run through this. It has legal implications, and it has implications around our practices. We are now working with one of the most diverse communities that we've ever worked with in social care and nursing. You're going to see all the colours of the rainbow while you're out giving care, and it's important that we're able to think about the care that we're giving. Remember, we're not asking you to change your values and your beliefs and who you are as an individual. What we're saying is, if you're out providing care, you must do so in a way which does not discriminate that person. If you find that it's difficult for you to manage those situations, it's important you have those discussions with your supervisors, because inadvertently you will be indirectly discriminating somebody, and it's important that we make sure we're not breaking any law or legislation whilst doing so. Equally, we wouldn't ask you to do something that you're feeling uncomfortable about because of your own protected characteristics. So please be mindful of those as you go through. Equality and diversity is a sensitive subject, and it's a subject that you'll do every 3 years as mandatory training and ongoing updates. If you need any further advice and guidance, you can go to the CQC websites or any of the websites that you've seen on here. So thank you for watching, and please ask your assessor for feedback once you've completed these workbooks.